Now I go to an important class of hemophilia. There are two types of hemophilias, Haemophilia A and Haemophilia B. Both are important university exam questions. First, I will deal with Haemophilia A. It is an X-linked disorder, absence of factor VIII. Females are the carriers, males are the sufferers. Rarely, the female also will be affected by a process called as lionization, where the other X chromosome also gets inactivated. There is a defective production of factor VIII-C. So this is a family chart over here. The father is normal, mother is a carrier. And when they do get married, father is XY, mother is XX. Now, if the X and Y are normal, the child is unaffected, a boy. Again, even if it is X and X, one X is sufficient. But in this case, what happens is there is a carrier because of the Y chromosome over here and the X over here. And in the last case, you find that the boy will be having a defective X chromosome, normal Y chromosome, as a result of which he becomes an affected child. There is no normal X in this child. The clinical presentation can be hemarthrosis. Look at this one, bulge in the knee. This can be given as a chart for us. Organization, hemorrhage in the joint spaces. Subcutaneous intramuscular hemorrhage. Increased bleeding time and prolonged bleeding after surgeries. The laboratory investigations will be factor VIII assay, APTT is prolonged, platelet count is normal, bleeding time is normal. The differential diagnosis will be the other bleeding disorders, von Willebrand's disease and any of the other factor deficiencies, DAC and hemophilia B. The treatment will be you will have to give the plasma rich in factor VIII. Desmopressin increases the levels of factor VIII. Complications can be there can be antibodies to factor VIII causing destruction, and sometimes too much of transfusion can lead to diseases such as AIDS. Detection of carriers, you'll have to do a test like DNA probe, RFLP, restriction fragment length polymorphism, or PCR, polymerase chain reaction. And these are the different types of mild, moderate, and severe hemophilia A. Hemophilia B is another one. There is a deficiency of factor IX. Previous one is factor VIII, this is factor IX. It is also called as Christmas disease, after the patient whose name was Christmas. X-linked recessive, it is more uncommon than hemophilia A, 1 in 60,000 live births. Spontaneous hemorrhage, hemarthrosis, and after surgery there is bleeding. The features are similar to hemophilia A, prothrombin time is prolonged, APTT is increased, and factor IX is reduced. In the previous one, factor VIII will be reduced. That is called assay of factors. Treatment will be fresh frozen plasma, transfusion of factors, and factor VIII, factor IX assay. Other coagulation disorders can be differential diagnosis. Other clotting factor deficiency, A fibrinogenemia or dysfibrinogenemia. And the carriers can be detected by means of the factor IX assay. DNA probe, RFLP I mentioned, and polymerase chain reaction. This is complete of hemophilia B, a university question. That brings us to the end of class 36.